Thank you all for coming out. Today I want to talk about some of the very important issues facing our country. But before I get to some of them, I wanted to take a moment to address the events in Iraq and the escalating crisis in the Middle East. Yesterday, President Trump ordered the assassination of a top Iranian general, Qasem Soleimani, in Iraq, along with the leader of an Iraqi militia. This is a dangerous escalation that brings us closer to another disastrous war in the Middle East, which could cost countless lives and trillions more dollars and lead to even more death, more conflict, more displacement in that already highly volatile region of the world. When I voted against the war in Iraq in 2002, I feared that it would result in greater destabilization in that country and in the entire region. At that time, I warned about the deadly so-called unintended consequences of a unilateral invasion. Today, 17 years later, that fear has unfortunately turned out to be a truth. The United States has lost some 4,500 brave men and women fighting in Iraq. Tens of thousands have been wounded. Hundreds of thousands of Iraqis have been killed, and trillions of dollars have been spent on that war. The result? Today, we have massive unrest in that country. We have corruption in that country. We have terrible poverty in that country. And now Iraqis want American troops out. All of that suffering, all of that death, all of that huge expenditures of money, for what? It gives me no pleasure to tell you that at this moment, we face a similar crossroads fraught with danger. Once again, we must worry about unintended consequences and the impact of unilateral decision-making. And let me repeat a warning I gave in 2002 during the debate over the war in Iraq. Quote, this is what I said back then. War must be the last recourse in our international relations. And as a caring nation, we must do everything we can to prevent the horrible suffering that a war will cause, end of quote. As the former chair of the U.S. Senate Committee on Veterans Affairs, I have seen close up the pain, the death, and the despair caused by war. I've gone to too many funerals in my own state. I've talked to too many mothers who have lost their kids in war. I have talked to too many soldiers, men and women, who have come home with PTSD, who have come home without arms and without legs. And I know that it is rarely the children of the billionaire class who face the agony of reckless foreign policy. It is the children of working families. Let us not forget that when Trump took office, we had a nuclear agreement with Iran, negotiated by the Obama administration, along with our closest allies. Countries from all over the world came together to negotiate that agreement. which put a lid on Iran's nuclear program. The wise course would have been to stick with that nuclear agreement, enforce its provisions, and use that diplomatic channel with Iran to address a wide range of concerns, including their support of terrorism. Unfortunately, Trump ignored the advice of his own security officials, and listened to right-wing extremists, some of whom were exactly the same people who got us into the war in Iraq in the first place. As we all remember, Trump promised to end endless wars. Tragically, his actions now put us on the path to another war, potentially one that could be even worse than before. The truth, as we all know, is that the world today is a very dangerous place. We are seeing a movement all across the planet towards authoritarianism. We are seeing a growing arms race, and we are seeing nuclear weapons in the hands of unstable and hostile regimes. I believe that in the midst of all of that, the role of the United States, difficult though it may be, must be to work with the international community to end conflicts, to end the threat of war, not to promote war as President Trump is doing. This is how the true power of the United States is shown. And that is how I will use American power as president. As I think we have seen for several years now, Trump makes decisions impulsively, without explanation, and in this case, as in the past, without any congressional consultation. I believe strongly that a key step in ending our endless wars is for the Congress to reassert its constitutional authority over matters of war. Our founding fathers had it right, and they gave the responsibility of war to Congress, and that is exactly where it must be placed. I find it incredible that at the same time as Trump is greatly expanding military spending, and I am proud to tell you that I have voted against all of Trump's military budgets. At the same time, he is spending tens of billions more on the military. He is cutting back on the diplomatic capabilities of the State Department to negotiate agreements around the world. And that, to my mind, is a very dangerous course of action. I have consistently opposed this dangerous path to war with Iran, but we need to do more than just stop the potential of a war. We need to firmly commit to ending the U.S. military presence in the Middle East in an orderly manner, not through a tweet, and must understand that these wars have cost us so much in blood and in treasure. We must end our involvement in the Saudi-led intervention in Yemen, which is now one of the worst humanitarian catastrophes on earth. And we must bring our troops home from Afghanistan. Instead of provoking more volatility in the region, the United States must use its power, its wealth, and its influence to bring the regional powers to the table to resolve conflicts. And let me conclude by simply saying this. At a time when we have over 500,000 Americans who are homeless today, including 30,000 veterans, at a time when some 87 million of our people are either uninsured or underinsured, and 30,000 die each year because they don't get to a doctor when they should, at a time when we face the urgent need to rebuild our crumbling infrastructure, to build the housing that we desperately need, and to address the existential crisis of climate change, we as a nation must get our priorities right. We must invest in the needs of the American people, not spend trillions more on endless wars. Thank you. Obviously, the situation in Iraq and Iran are of great concern, but I wanted to touch on some other issues as well. And I wanted to tell you that what our campaign is about and what our administration will be about is not just defeating Donald Trump, who in my view is the most dangerous president in the modern history of our country. But what our administration will be about is more than that. Our administration will understand that there are enormous crises facing this country that we must address. We must address the corruption of our political system in which billionaires today are able to buy elections. Now, I may be old-fashioned, but I believe that democracy means one person, one vote, not big money interests controlling the way our government works. And what our administration will be about is addressing a moral issue and an economic issue that we just don't talk enough about, and that is the growing level of income and wealth inequality that exists in America. We need an economy and a government that works for all of us, not just a handful of wealthy campaign contributors. Now, we don't talk about it, but there is something profoundly wrong when, as a nation, we have 3 people who own more wealth than the bottom half of American society. Something profoundly wrong when the top 1% owns more wealth than the bottom 92%. Something profoundly wrong when here in Iowa or in my state of Vermont, we got people working 2 or 3 jobs to take care of their families, yet 49% of all new income goes to the top 1%. Something profoundly wrong when over the last 30 years, the top 1% have seen a $21 trillion increase in their wealth, while the bottom half of American society have seen a decline in their wealth. Something profoundly wrong when over the last 45 years, when we have seen an explosion in technology, when we have seen worker productivity substantially increase, despite all of that, the average worker today makes almost exactly, in real inflation accounted for dollars, what he or she made 45 years ago. That is unacceptable. And we together are going to create an economy that works for working families, not just billionaires. And what that means, this is not radical stuff. This is stuff that is pretty commonsensical, and it is what the American people want. I have talked to too many people in Iowa who are trying to get by on 9, 10, 11 bucks an hour. And you know what? You can't get by on 10 or 11 bucks an hour. That is why we will raise the national federal minimum wage to at least $15 an hour. That is why we will make sure that women receive equal pay for equal work, not 80 cents on the dollar. And that is why we will make it easier for workers to join unions, not harder. And when we look at the future of our country, we must thoroughly re-examine what is happening with education in America and in general, how we treat our children. We are the wealthiest country in the history of the world, and yet we have the highest rate of childhood poverty of almost any major country on earth. Unacceptable. All right? Today, all over this country, in Iowa, in Vermont, all over this country, mom goes out to work, dad goes out to work, and yet working class families cannot find decent quality, affordable child care. We're going to end that. I believe, you believe, in universal, high quality, affordable child care for every family in America. This is the world's wealthiest country. We must have the greatest public education system in the world. We must have a system which pays our teachers the salaries that are commensurate with the enormously important work they do, at least $60,000 a year. I want our young people in college today to say with pride, I am so excited that I am going to become a teacher because it is one of the most important jobs that we can do. We must invest significantly in low-income, in Title I schools. We're going to triple funding for Title I schools. And by the way, in this great country, we must make it clear that any person who has the ability and the desire should be able to get a higher education regardless of the income of that family. If the United States Congress, against my vote, could bail out 11 years ago the crooks on Wall Street whose illegal behavior nearly destroyed our economy, if 2 years ago Trump and his friends could give $1 trillion in tax breaks to the wealthiest people in this country and the largest private corporations, we can make sure that our public colleges and universities are tuition free, and we cancel all student debt in this country. And we do that, we pay for that through a modest tax on Wall Street speculation. We bailed out Wall Street. It's time for Wall Street to help the working families of this country. And as president, I will finally lead the way to do what presidents in this country have talked about for well over 100 years, going back to Teddy Roosevelt. And that is that health care is a human right, not a privilege. It's not a new concept. It is a concept that exists virtually all over the industrialized world. It exists 50 miles away from where I live in Burlington, Vermont, where we border on Canada. And what that means is that we must have the courage, finally, to do what Teddy Roosevelt talked about, to do what FDR talked about in the 30s and 40s, what Truman talked about, what JFK talked about, what Lyndon Johnson talked about and actually did something about, what Obama talked about, what Jimmy Carter talked about. We have got to make it clear that the function of a rational healthcare system is to provide quality care to all, not billions in profits for the drug companies and the insurance companies. And that is why I strongly support and am proud to have written the Medicare for All single-payer bill in the Congress. Now, what does that mean? Now, you're going to hear a lot of misinformation about Medicare for All, so I may as well tell you the truth. Because the healthcare industry and the drug companies and Trump and the Republicans and some of the Democratic establishment will be telling you something else. So what does it mean? What do we mean by it? All right? Not a radical idea. It's an idea that exists in Canada, although we're going to do it better, exists in many countries around the world. Number one, we start with the understanding, and it's important that everybody knows this. We are now spending twice as much per person on health care as the people of any other country. Got that? We're spending over $11,000 for you, and your kids. Double what other countries are spending. And what are the results of all of that expenditure? We got 87 million people who are uninsured or underinsured. And let me underline that word, underinsured. Okay? We got 30,000 people who die every year because they don't get to a doctor when they should, because they don't have proper insurance. And here's an amazing fact, and I've talked to people in Iowa about this. Because health care is so expensive in this country, we have 500,000 people who go bankrupt every year because of medically related illnesses. Think about that for a moment. Think about somebody who is struggling with cancer, struggling with heart disease, somebody in the family struggling with Alzheimer's or some other terrible illness. Think about all that they have to do to figure out how they get well, how they treat those illnesses. And then on top of all of that, if you're a working class person and you're running up a big health care bill, there is a strong likelihood that either your family will go bankrupt, or your credit score will be shot because you can't pay your medical bills on time. Going bankrupt because somebody has cancer is unacceptable, and that is something we will end in this country. So what is the program? Very briefly, this is what it is, a 4-year transition program, but it starts off by ending premiums in America, all right? And I want you all to think about, because I'm criticized every, Bernie, how are you going to pay for Medicare for all? It's a fair question, and I'm going to deal with it. But the equally important question is, how do you pay for health care today? How do we pay for health care? So we are going to eliminate, and I want to open this for discussion in a moment, but Medicare for all eliminates all premiums for workers and their employers. Not a radical idea, exists all over the world. We eliminate co-payments, so you can go to the doctor's office even if you don't have that $100 or $50 that you need. We eliminate an insane concept that we have come to accept. It is called a deductible. Think about the insanity of what a deductible is. When you have insurance, the assumption is, whether it's too expensive or not, that's one thing. But when you get insurance, it's, well, thank God I have insurance, I'm going to go to the doctor. Well, not quite. Because if you have a $5,000 deductible, $10,000, whatever it may be, you got to pay the first $5,000 or $10,000 out of your own pocket. Well, what happens if you don't have that $5,000 or $10,000, which is certainly the case for many millions of Americans? Well, you don't get to utilize your insurance. We eliminate the absurd concept of deductibles, gone out of Medicare for all. We also eliminate all out-of-pocket expenses. And I'll tell you what else we do. Because Medicare today is a strong program. And I'm sure that people here over 65 are in the program. But we have got to improve Medicare. What we do is expand Medicare to include dental care. Because the last that I heard, dental care and oral health is a health care issue. We expand Medicare to include hearing aids and eyeglasses, and I'll tell you what else we do. We expand Medicare to cover home health care, so that people are not forced out of their homes into a nursing home. And we do all of that over a 4-year period. So the first year, we expand Medicare to cover what I just said, and we lower the eligibility age from 65 down to 55. Next year down to 45, next year down to 35, next year everybody is in Medicare. Medicare for all. Now, what I want to do is I need your help. I want you to help me out on this issue. This is what I do at virtually every meeting like this that we hold. I get criticized. How you pay for health care is a real and legitimate issue, okay? And it's an issue we need to discuss. And I get criticized, as I mentioned a moment ago, how am I going to pay for Medicare for all? I'm going to tell you that in a moment. But I want to talk about how we pay for health care today, okay? How do we pay for health care? We pay for it through premiums. If you're in you have employer-based health care, you pay for it through premiums, or you're self-employed. I want to talk about premiums. How much are people, anybody here want to volunteer as to how much they're paying in premiums? Ma'am, stand up, there's a mic right here. Just give us your name if you could, please. Yeah. Turn around, face your friends.
I paid $600 just for my husband and I. And
a month?
A month. Plus we have a $6,000 deductible.
Yep.
And then we have a 20% copay. So virtually last year we paid $17,000 in medical, and I'm still making payments today on some of those bills and still paying these high premiums.
Okay.
So.
That is, thank you very much. And I know it's not easy for people to stand up in front of the TV cameras. Just ignore them. I ignore them all the time. They ignore me, I ignore them. We have a great relationship. No, but that is, I'm going to get back to you in a moment. I am not going to forget you. You're sitting right here in front. All right, but here is the point. I am assuming you're not a billionaire. Is that a correct assumption? All right, I'm writing. That's how perceptive I am. Pick it up right away. So I make a great president. I pick these things up. Okay. All right. All right, but here's the point. This is, I'm assuming, a working class, middle class person, right? Average Iowan, paying $17,000 a year. That's a big chunk of your income, I'm assuming. All right. Please help me out here. What are we talking about in premiums, deductibles here? Who wants to volunteer? Now, don't be shy. Premiums or deductibles? I see a hand over there. Why are the women braver than the men here? All right. Okay.
Excuse me.
Okay, stand up if you could, please.
Sure. So I have employer insurance,
Right.
and my premium is actually not that bad. It's about $180 a month. But the employer pays significantly more every month, so it's about $500 for their contribution. And I'm sure my kids and I do not spend equal to what our my employer pays on our behalf every year, just for preventative care.
Okay.
But it's a lot of money.
Do you have any deductibles in your insurance?
It's very small.
Okay, because you have a
Yeah.
fairly
So
good,
we're
you have a good
pretty-
employer who's been pretty generous, yes?
Yeah, I have a very good employer, but if I didn't have a good employer, the medicine that I was on for multiple sclerosis for many years cost $2,800 a month.
Okay.
My employer helped me with most of that.
You're
But
a
I was an exception, I know.
You're a lucky person because you
It
have
would
a,
have been $30-some thousand a year just for that medicine.
and how could you have paid that?
Not,
You couldn't. Okay.
I would be in a wheelchair.
Okay, thank you very much. More on premiums and deductibles. Who wants to talk a little bit about their own family experience or people that they know? I see a hand over there. The reason that I do this, by the way, is that I know that people are shy and don't want to, get up and give their story. But what we're talking about here, your story, is what millions of people. And the more we talk about it, the more people say, wait a minute, this is really an absurd way to pay for health care. Sir?
Well, Bernie, I'm a union carpenter, and we put $8.17 every hour I work towards my insurance. $1,100 a month, $200 deductible, but it's very
So
expensive.
despite having presumably being in a union and a decent benefit, you're still paying how much a month?
We allocate $8.17 an hour. That could be on my check.
All right,
that's
so
what I
instead
try
of
to
getting
tell
that in your paycheck, that's going to health care.
Yep,
And let me guess that every time there's a union negotiation, that issue of health care comes up.
yep, every time.
Yeah, okay. All right, thank you. Very important issue. Okay, anybody else want to talk about? I see a hand back there, sir. Okay. Let's see, we're keeping Misty on her toes.
My family was small farmers, and I think when my parents retired, they were paying between $20,000 and $25,000 a year. Private health insurance, all on their own. And the problem was, for the last 15 years, every time the bill showed up, they didn't even want to open the bill because they knew it was going to be a double-digit percentage increase, and they were just praying that they could make it to Medicare age before they had the major illness that got them thrown off their insurance. I mean, and they kept being pushed into a pool that was higher and higher, and then the insurance company would come to them and say, well, we can get you in a better pool if you'll raise your deductible about $3,000 or $4,000.
Money coming right out of
That was
their
our
pocket.
experience.
Okay. And that reminds me, I mean, in my state and your state, we have a lot of family-based agriculture. And farmers are not doing well. And paying $15,000 and $20,000 a year for health care is something that many of them just cannot afford. All right, more on premiums and deductibles. Yes, right here. Okay, Misty. I don't do this intentionally to get you to run here.
You okay?
I'm going to speak for the people who are on Medicare. My wife and I...
Hold the mic close to your mouth, please.
Okay. My wife and I are both on Medicare. They take $143 a month out of each of our check for health insurance, and then the supplemental insurance through United Healthcare is an additional $243 each. So it's not perfect.
No, it is far from perfect. And we will end your need to buy supplemental insurance because we're going to cover what you're paying for right now. What about deductibles? What kind of deductibles do people have? What kind of deductibles? Yep, you yell it out.
I don't pay anything.
Okay.
I'm a vet, so
You go to the VA?
no deductibles, no nothing. So I guess what I'm trying to say is, if I can do that, why can't everybody?
Well, that's what,
And that's what you're for, right? So,
yes, that's what we're talking about.
like my VA.
Okay, gentleman right here, deductibles?
No, I'm a vet, and I can't even get in the VA. I was in from 68 to 73, Vietnam, and they won't let me in.
We can talk about it after the program. I'm the former chair of the Veterans Committee. Okay, that's wrong, obviously. All right, yes, ma'am? Healthcare?
Last year, I'm self-employed. Last year, I was in the marketplace and I paid $180 a month and I had an $8,500 deductible.
Okay. All right, here's the point. Thank you all very much for volunteering that information. Here's what we propose, and what exists, again, all over the world in one form or another. I would be lying to you, and you wouldn't believe me if I told you healthcare is free. Not free. It's got to be paid for. The question is how you pay for it. All right? We are going to pay for it in a fair and progressive way. When this woman is paying $17,000 a year, that ain't fair and that ain't progressive. So this is how we pay for it. We pay for it with a 4% income tax exempting the first $29,000 of income. The average family in America, the person in the middle of the American economy, makes about $60,000 a year. That means for that family, exempting the first $29,000, they're paying 4% of $31,000, which is a little over $1,200 a year. A little bit better than what you're paying right now. Okay? That's how we do that for comprehensive health care. Go to any doctor you want, any hospital that you want. Okay, that's how we pay for that. Also, now how do we do that? Why do we do that? How are we able to come up with that? And we pay for it in other ways as well. But one of the things that we understand is that the pharmaceutical industry is not only greedy, you all know that they're incredibly greedy, but they're corrupt. They engage in collusion and in price fixing. So they collude to drive prices up. Some of you may know that a number of months ago, I made a trip from Detroit to Windsor, Ontario, to buy insulin for people who had diabetes. Anybody here have diabetes? I see a few hands up here. Okay. What we did in Canada is buy the same exact product sold in the United States. Who knows what the differential was in Canada? How much cheaper it was in Canada? Anyone know? It was 1/10 the price. You got it? 1/10 the price that people in the United States were paying for the same product, 15 miles apart. How so? Help me out here. How does it happen? And it's not just insulin, of course. And by the way, in terms of insulin, what I learned on that trip, this is how crazy and dysfunctional our healthcare system is. 7.5 million people use insulin in America. About a quarter of them are rationing their insulin. Can you believe that? Which means some may die and some are getting sick. Same story that that woman told us a moment ago. If she didn't have insurance, what would happen to her if she didn't get the medicine she needed? 1 out of 5 people in this country, when they get a prescription from their doctor when they're sick, cannot afford to fill that prescription. Meanwhile, you'll all be delighted to know that last year the 6 major drug companies made $69 billion in profit. So one of the ways we're going to lower healthcare costs in America is we're going to take on the greed and the corruption of the pharmaceutical industry. The people of our country will not be paying more than the people of other countries for the medicine that they need. All right? Now, how else do we save money? How can we come up with such a cost-effective way to provide comprehensive health care at all? Well, one of the reasons that our healthcare system is so expensive is that there are thousands of separate and different healthcare plans in America, all right? You have a $5,000 deductible. You got a $10,000. You're in this network, you're in this network. Your plan covers this prescription drug, your plan covers that prescription drugs. You can go here, you can go there. To administer these thousands of programs, just think about what a nightmare it is. You're a hospital, you're a doctor's office. To administer all of these different programs costs us many, many hundreds of billions of dollars a year. Medicare for All is a simple program. You got a card. You go to any doctor you want, any hospital you want, you walk in there, they, put you into the computer or whatever it is. That's it. You don't take out your wallet, you don't take out your credit card. If God forbid you end up in the hospital, you walk out without a bill. It is a simple system, non-bureaucratic. And one of the things that people hate about this system is the incredible bureaucracy and the fights that have to take place every day with the insurance company to determine whether or not you're going to get coverage for what you thought you paid for. Right? Is that true? All right. This is a simple system. That's how you save money. You walk in, you get the health care you need. You don't have to argue with anybody. All right? We don't have to pay people to argue with you. All right? All right. Last point that I want to get off of health care and just touch briefly on another point that will open it up for your thoughts. Anybody who tells you, as Donald Trump does, that climate change is a hoax is not only lying to you, but is really unbelievably endangering the lives and well-being of their own children and future generations. Just astounding to me that people are prepared to ignore what the scientists are telling us and endangering the well-being of their own kids and grandchildren and future generations. What the scientists are now telling us is not just what they have told us for years, that climate change is, of course, real, that it is causing serious damage in our country and around the world. What they are now telling us is that the crisis is much worse than they had originally believed, okay? That as a result of man-made activity and the warming of the planet because of carbon emissions, we're seeing the polar ice cap melting at a far faster rate than they had anticipated. The oceans are warming at a faster rate. Result is rising sea levels, which means if we don't get our act together, cities in the United States, don't mean to frighten you, but cities in the United States, like Miami, like New Orleans, like Charleston, South Carolina, maybe New York City, will be partially or completely underwater by the end of the century. And when we talk about increased drought for farmers, it means that the growing season will be shorter, crop production will go down, and the quality of the food being produced will be less nutritional. We're talking about more extreme weather disturbances, massive torrential rainfalls, flooding cities like Venice, Italy, Houston, Texas. When we talk about drought, we are talking about what exists in Australia. Anybody seeing Australia right now? This is not the end. This is, if we don't get our act together, what is going to be taking place all over the world. I was in, last year, I was in Paradise, California. That name of that town mean anything to people? That was where they had that terrible, terrible wildfire that killed 86 people. It was unbelievable to see the damage done. What we're seeing in the oceans is the killing off of millions of fish, which means that people around the world who get their protein from fish are not going to have access to that. What the United Nations tells us is that we're looking at climate refugees. People will be forced to leave their homes around the world by the perhaps hundreds of millions because they can't find drinking water or land to grow their crops. And when hundreds of millions of people migrate, man, you have the potential for real international conflicts. All right? I am proud to tell you, I've been criticized for this, but, you know, you got to do what you got to do. And I have introduced the most sweeping, comprehensive climate change proposal ever introduced by any candidate running for federal office. And people say it is too expensive, you know, and you tell me, I want you all to think about, what is the alternative? We are fighting to save the planet, and if you think the damage being done in Australia today is cheap, you're wrong. They're going to have to spend billions to rebuild what happened. Think what happened in Paradise, or Hurricane Sandy cost us $60 billion when it hit the East Coast, all right? So one way or the other, we're going to be paying for it. I would rather pay for it, do everything we can to prevent the crises that are imminent. And here is the other problem. It is not just that we have to take on the fossil fuel industry, but if tomorrow the United States did everything great, we transformed our energy system away from fossil fuel to energy efficiency and sustainable energy, that still would not be enough, because this is a global problem. So what I'm here to tell you is, unlike Trump, I will not ignore the problem. I will not tell the people of this country and the world that it is a hoax. What I will tell them is that it is an existential threat to the entire planet. And I will do my best as president of the most powerful nation on earth to tell the people of China and Russia and India and Pakistan and Brazil and countries all over the world that maybe, just maybe, instead of spending $1.8 trillion a year on weapons of destruction designed to kill each other, maybe we should pool our resources and fight against our common enemy, which is climate change. Okay, I have gone on probably too long, and there's whole other issues, many issues. You'll forgive me. You know, I wanted to start off with discussing the situation with Iran. So there's a lot of issues I didn't discuss, but if something's on your mind, we can have some time to take some questions. All right, where are the mics? Mister, you got a mic? Is that the only mic we got? God, we're raising all this money and we end up with one microphone. All right, all right. The gentleman right over there. Yes, sir. You stand up if you could, please.
I have a proposal for your Medicaid or health program. Maybe you should have a law that will outlaw the drug companies from advertising all these drugs on TV and newspapers and magazines.
You're right. You're right. And I'll tell you, if you ever listen to these ads, if you take this medicine, it might lead to cancer, constipation, death, headaches. My God, you wonder why anyone would want to take that medicine in the first place. But you're right, because what that does, you know, the pharmaceutical industry ends up spending, you know, they claim that they're spending all their money on research and development, trying to come up with drugs for cancer and Alzheimer's, and they do spend some. But they spend more on advertising and promotion and giving their CEOs, you know, millions of dollars a year in compensation. Your point is well taken, and I agree with you. Okay, other comments or, okay. Yeah, okay, yeah.
I want to thank you. First of all, I want to thank you for coming to Paradise. That's where I'm from.
Oh, is that right?
And, you know, it's kind of like the economy. It's a recession when your neighbor loses their job, and it's a depression when you lose yours. It's inconvenient when somebody else's place burns down, people are killed. When it's your place, it's an emergency. And I appreciate you for standing up for the world, because without addressing climate change, we're doomed, no matter what we do politically other than that. And I want to thank you for that. I got to run because I got to take my sister to physical therapy. And by the way, it costs about $100,000 to get 2 knees replaced in this country today. And that's pretty bad.
Okay, thank you. Okay, I see a woman over there, Misty.
Hi, Hi, Bernie. I really appreciated your explanation of the healthcare plan and how we were going to pay for it. One thing that I just have a question about, if I misunderstood, was will that 4% tax be a flat tax, or is it going to be progressive? So that someone that makes $250,000 a year, are they going to pay the 4% that someone who makes $60,000 is going to pay?
In this case, yes, but we have a number, as my friends on Wall Street and the billionaire class know, we have a wealth tax and in general a progressive income tax to make sure, thank you for raising this issue, that in the midst of massive income and wealth inequality, the people on top will pay substantially more in taxes, but not for health care. They'll pay 4% of their income. Okay, ma'am, right here.
I woke up this morning very angry, and then I heard about what Trump did. And I can't call him president because he is not a president. And I'm tired of hearing about young black people getting shot. I don't know what to do. I'm lost.
Well, one thing we cannot do is allow Trump or anybody else to put us in a state of despair. Because sometimes they want to do that. It's so, and believe me, everybody feels that. You read the papers, my God. You know, we talked about climate change. You talk about the potential of war. For the sake of our kids and future generations, and I got 4 kids and 7 grandchildren, we cannot allow ourselves to be in a state of depression or despair. And what this campaign is about, and I'll give you good news, the other side of that despair is, and I don't mean to be boasting here, but you know, we have in this state and all over this country just hundreds of thousands of people who are working hard to try to change this country through a strong grassroots movement. I've been all over this country, and I want you to know there are beautiful people, young people, who really are prepared to fight for justice. And so I want you to know that. But in terms of, you know, you raised the issue of people being shot, African Americans being shot disproportionately, criminal justice is an issue right up there on my agenda. Okay, and in terms of criminal justice, very briefly, we have got to ask ourselves, how do we have more people in jail? We have over 2 million people in jail today, disproportionately African American, Latino, and Native Americans. All right? So what I believe that we should invest in our young people in jobs and education so that when kids are in school, they have the tools that they need, not to drop out, not to hang out on a street corner, but to become productive members of society. We invest in that rather than more jails and incarceration. All right? The other thing we do is end cash bail. Does anyone know what I talk about when I talk about ending cash bail? There are 400,000 people. Now I want you to hear this. This is, you talk about criminal justice? This is criminal injustice. You got 400,000 people in jail today, right now, who haven't been convicted of anything. How does that, you know about that? Okay. How do people end up in jail if they haven't been convicted? Help me out here. They can't pay their bail. So you're arrested. Maybe you're arrested for good reasons, maybe for bad reasons. I don't know. Maybe you're innocent, maybe you're not. But if I put you in jail and you can't afford the $500 you need for bail, you stay in jail. And if you are innocent, you know what you're going to do? You're going to reach a plea bargain which has you pleading guilty maybe when you weren't guilty in the first place. All right? We're going to end cash bail. Tell you something else, what we're going to end. Maybe people agree with me, maybe you don't. But we will end, if I have anything to say about it, the so-called war on drugs. And what that means is we are going to legalize marijuana in every state in this country. And we'll expunge the records of those who have been arrested for possession of marijuana. We're going to end private prisons and detention centers because people should not be, corporations should not be making more money by having more people in jail. That's a disincentive. We want fewer people in jail. I don't want corporations creating laws to arrest more people so they make more money. So that's, you're touching on a very important issue. And it's one I normally speak to, but I didn't today because of the Iraq situation. All right, let me get to some people in the back. Okay, I see a gentleman over there.
Hi, Mr. Sanders. My name is Avery Cassell, and I was just curious, when you become president, what are you going to do about gun control? Because it seems like nowadays we hear all these shootings about in schools, elsewhere, and all these teens that put their hands on guns and taking other people's lives. So it's been happening a lot. So it's
Avery, again, that's an issue that I always talk about as well, but I cut it short tonight, so thanks for asking. All right, look, what Avery is saying, in all over this country, I mean, we are horrified. We are numbed. We are frightened by the level of gun violence and mass shootings that have taken place. And, you know, just a while back, a woman in New Hampshire said to me, Bernie, what am I, and by the way, it's not just the killings, it's the fear that exists. Think about it. You know, when I was a kid going to school, you go to school to learn. Occasionally you learn something, you know. Try to learn, supposed to learn. Not all of us were great students. You go to school to socialize. Kids are going into school today frightened. And some mother in New Hampshire, this woman says, Bernie, what am I supposed to tell, think about this, my 11-year-old daughter who asked me to get her for Christmas a bulletproof backpack? Think about the trauma that that kid is taking into school. My grandchildren undergo the same drills that your kids and grandchildren undergo. Think about what that does, the fear that puts into that. So you asked the question, let me give you just a brief answer. Number one, and most importantly, our gun policy will be determined by the American people, not the NRA, all right? And what we have today is a broad consensus. I'm not here to tell you everybody agrees. But over the years, as a result of these terrible shootings, what you see is gun owners, non-gun owners, people from rural states like mine, where we got many thousands of people who hunt and own guns, and urban areas, you know, like Los Angeles or Chicago. You are seeing a broad consensus. And some of that consensus, it says, we will expand and have universal background checks. If you have a history of violence, you know what? Sorry, you should not own a gun. All right? Number two, we do away with the gun show loophole, which today allows you to legally purchase a gun without doing a background check. Three, we end the so-called straw man provision, which allows you to walk into a gun store today, legally buy guns, do a background check, and then sell those guns to gangs or criminal members. Fourthly, and this is a new consensus which has been forged, I think, in recent years, something I believed in for decades, and that is we end the sale and distribution of assault weapons in this country. Those are weapons not used for hunting. Those are designed, as we saw in the terrible tragedy in Las Vegas a couple of years ago, mowing down people as quickly as you possibly can. These are weapons of war, not for civilian use. Okay, so that's a brief discussion of what we do on, okay, I see a woman over there. Oh, Misty, I'm so sorry, you're running. All right, then maybe we'll stay on one side and then go to the other side. Yeah.
I love your ideas, Bernie, but what are you going to do about the partisanship that prevents any good Democrat from getting anywhere in Congress right now?
Okay, we're going to run a different type of presidency in the same sense that we're running a different type of campaign. So I don't want to get you nervous, but we're going to do it very differently than they have in the past. And let me give you examples. And you can see the example in our own campaign. Not so many years ago, I mean, we're talking about, you know, in the last 10 years, when people ran for president of the United States, it was a very simple formula. This is what Democrats did and what Republicans did. You go out to rich people and you go out to their homes and you sit down with 20 or 30 millionaires and you leave with a few $100,000 and you thank them very much and you make sure, they make sure that they continue to have access to you and you do what they want you to do. As a result of this disastrous Citizens United Supreme Court decision, you now have billionaires who can put money into super PACs to help elect the candidates who represent the wealthy and the powerful. So to answer your question, our campaign is a manifestation of what we're going to do in the White House. We're doing it differently. We have revolutionized how you run presidential campaigns and how you fund them. I do not have a super PAC in which billionaires make contributions. I don't want a super PAC because our campaign and administration is there to represent working families, not the wealthy. I don't go to rich people's homes to raise money. Don't do that. What we do is ask working families to contribute overwhelmingly on the internet. And the result has been that we have received more than 5 million contributions in this campaign, more than any candidate in the history of American politics. Okay? So, I use that wasn't your question, but being a good politician, I gave you the answer before I answered. All right. I gave you that answer to tell you how you can be successful and do it differently. So we're raising money, all right, but we're doing it in a different way. All right, now you asked me the question, how do you deal with the divisiveness, which is certainly very real? And the answer is, we bring the American people together around an agenda that is in fact widely supported by most people, okay? Despite what the media will tell you sometimes, on major issue after major issue, there is in fact widespread agreement. Gentleman asked me about guns. You know what? Most of the agenda that I gave you about guns, most Americans, Republican, Democrat, conservative, progressive, not all, most would say, yeah, that's right. The NRA says no, most Americans say yes. 4 years ago when I was here in Iowa, I talked about the need to raise the minimum wage to a living wage of $15 an hour. And since then, by the way, that concept has spread to many states around America. Most Americans, Democrats, a lot of Republicans, support that idea. Talk about making public colleges and universities tuition free. Well, you know what? Republicans can't afford to send their kids to college either. All right? Republicans are getting drowned with student debt. Republicans don't have any health care or are paying outrageous costs for the health care and the prescription drugs they need. More and more Republicans understand that Trump is wrong, climate change is real. You've had some conservative Republicans working on the issue of criminal justice and immigration reform. So to answer your question, 2 things. Number 1, we bring the American people together in trying to create an economy that works for all of us. And I've mentioned some of what we do. Number 2, I will be an active president, and I am prepared to go to states and explain issues like raising the minimum wage to a living wage, to go to Kentucky and to other states to explain to the people there what we are trying to do. And when people begin to stand up and fight for policies that represent working families, no politician is going to stand in their way, okay? So that is kind of, I know you're not 100% convinced, but it's not just sitting down and arguing with Mitch McConnell. It is getting people to stand up and fight back. And when you have that, you know, politicians are many things. They're not stupid. And when they begin to see that people want to raise the minimum wage to a living wage, that they want Medicare for all, for their own political survival, that is what they will do. That's what our approach is. Okay, I see a gentleman right next to you, Misty.
This will have to be our last question, sir.
Okay.
Hi, Senator. My name's Everett Chase. I'm running to be the state representative for this district. And I have a question for you about trade.
Good.
I work up the road at Walmart, and I know that a lot of the products that come into our store come from China.
Yes.
And as a lot of us know, the reason they can make it so cheap is because they use exploitative labor in foreign countries. So my question for you is if you would be in favor of a trade agreement or a bill that would heavily tax or outright ban products that were made using exploitative labor practices in foreign countries.
Well, it depends on what you mean by the word exploitative. Right now in China, people are being paid, or Vietnam, or even in Mexico, less than a couple of bucks an hour. So to answer your question, you're looking at somebody who voted against NAFTA, against permanent normal trade relations with China, and other disastrous trade agreements that have cost us millions of jobs.
Thank you.
Okay, and I will create a trade policy that is fair, that works for workers in this country and workers abroad, not just for the CEOs of Walmart and large corporations. All right, I apologize. I think we've got to get going here. Let me just conclude by simply saying this. I believe we stand an excellent chance to win here in Iowa. And it's not just because we're putting television ads on and radio ads. Misty, all right. Now Misty there, the woman with the microphone, is, among other things, she's our state director here in Iowa. And where were you born? I always forget the town you were born in. Grinnell? Oh, she's born in Grinnell, okay. So she knows the state. And the reason we're going to win, and we need your help on this, is Misty promises me, and you can see that face, she's an honest person, we're going to knock on 500,000 doors in the month of January. All right? We're going to be talking to people all over the state, and we're going to be urging them to come out on caucus night, which is February 3rd. So we are running, not only in Iowa, but all across this country, I believe the strongest grassroots campaign anybody has ever run. And that is why, with your help, I believe we're going to win here in Iowa, we're going to win the Democratic nomination, and together, we're going to defeat the most dangerous president in American history. Thank you all very much.